Thank you for attending this session on Fast Tracker, a resource for finding substance use disorder treatment openings. My name is Cindy Swan-Henderlite, and I work in the Department of Human Services Behavioral Health Division with Fast Tracker for substance use disorder. We're excited to have the opportunity today to provide you with some background on how Fast Tracker for substance use disorder came to be, details on how to use Fast Tracker, and how to list your licensed services on Fast Tracker if you're not currently registered there. A little background. In 2012, the Minnesota legislature passed legislation directing the Commissioner of the Department of Human Services to collaborate with service providers, counties, tribes, health plans, and other stakeholders to, quote, develop a model of care to improve the effectiveness and efficiency of Minnesota's current service continuum for chemical dependency individuals, end quote. In response, DHS directors established a steering committee of statewide representatives, stakeholders, and constituents. One of the priority areas of focus was to improve access to treatment and to the assessment process for substance use disorder. As you know, wait times for an assessment and for authorization to access substance use disorder treatment can be significant deterrents to individuals seeking help. Timely access to services are vital because the window of opportunity, the person's desire to get help, frequently subsides, and failure to get a quick and accurate assessment can literally mean the difference between life and death for an individual with substance use disorder. Fast Tracker, initially developed as a free online search tool for Minnesota mental health, was identified as a resource that could be expanded to facilitate quicker access to substance use disorder services too. So in 2017, a federal grant award provided DHS with the funding to build and support Fast Tracker for substance use disorder. Minnesota's free, online, searchable database where you can find current treatment openings with over 350 licensed substance use disorder treatment and withdrawal management, detox facilities, tribally licensed programs, and now qualified independent individual practitioners. There is no cost to register on Fast Tracker, and there is no cost for searchers to use the site. Fast Tracker is a public site where individuals, family members, assessors, mental health providers, counties, managed care organizations, or other health providers can find current statewide substance use disorder treatment openings and details of the services that they provide. It's my honor and privilege to introduce Linda Vukelich and Samantha Meulemans, the heart, soul, and brains of Fast Tracker for substance use disorder. Linda Vukelich is the Executive Director of the Minnesota Community Mental Health Foundation and the Minnesota Psychiatric Society. Linda has a passion for collaboration and nearly 30 years of experience with nonprofit organizations, working with professionals from psychiatry, general medicine, law, education, and policy. Linda's natural networking skills, combined with her curiosity and creativity, help her to see possibilities and work with others to make them happen. Samantha Meulemans, the Fast Tracker substance use disorder specialist, is a licensed alcohol and drug counselor and brings 13 years of experience in the substance use disorder field to her role with Fast Tracker. Sam has served adults and adolescents in a variety of settings. And in her work as a case manager, she notes that Fast Tracker would have been a great resource if she had known about it then. Samantha is dedicated to making sure people are aware of Fast Tracker and the resource it offers to the individuals affected by substance use disorder and to you folks, the professionals who serve them. So it's my pleasure to introduce Linda Vukelich. Thank you.
Thank you, Cindy. I'm happy to be here. As Cindy said, my name is Linda Vukelich, and I'm the Executive Director of the Minnesota Mental Health Community Foundation and also the Executive Director of the Minnesota Psychiatric Society. It was in that role with the Psychiatric Society that I first became aware of the need for a centralized resource and referral tool. A little background. When I started with MPS in 1997, the internet was well established and growing in popularity. but we were still primarily facilitating resource and referral functions using phone and fax. I took calls from the public and provider community looking for psychiatrists on a nearly daily basis. That was when the yellow pages was the best we could do. We decided to do something about it and came up with the idea of Fast Tracker. It took several years of planning and searching for funding and IT support, but we went live in 2012. Since then, we've grown our service and engaged statewide support from DHS and our provider communities. What makes Fast Tracker different is that it shares real-time information directly reported by the substance use disorder and mental health provider communities. This has been a collective effort, and I'm proud to say Minnesota can claim it as totally homegrown. Fast Tracker allows searchers and providers to efficiently connect, so it saves resources for everyone. Providers reduce contacts for services they don't provide, and searchers focus their efforts productively. Time trials show that Fast Tracker takes 85% less time than current referral methods. Case managers love it. We're dynamically improving the site through contacts with our community, and we are always happy to consider suggestions from users. We want to make this tool one that continues to serve our collective needs. We recently added COVID Cares, which is a warm line support service. And we have, through the pandemic, been supporting virtual services and availability and reminding our provider community of their importance. We did provide slides for you today, but they go into great detail and therefore your reference. We plan to use our time with you today to introduce or reintroduce Fast Tracker as a tool you can use in the important work that you do every day. Please share the PowerPoint slides with your colleagues. We ended with our contact information, so we're always happy to respond to any questions and happy to get any contacts that you'd like to share. We love to hear from our users who have ideas for making Fast Tracker even better, so please reach out. In just a minute, Samantha will go over the main functionality and demonstrate how it works. I just want to quickly go over a couple of the roles and basically describe their function and how they make Fast Tracker work for you. As I mentioned, Fast Tracker is a collaborative endeavor. We ask our Fast Tracker admins to be our connection points with the provider community. They set up program profiles and update information and openings. That staff position is usually someone close to the census. We've streamlined the process, so setting up the original profile generally takes less than 10 minutes. And daily updates take less than one, usually just a few seconds. We've been collaborating with Fast Tracker admins to make this role smooth and efficient. As our partners, Fast Tracker admins are assigned login privileges. You can have more than one Fast Tracker admin, and we encourage you to do that. Many programs add their info email as a backup for coverage and staffing changes. That way, if somebody is out for an extended leave or if there's a transition in staff roles, you don't have a gap in your information. The other main role is that of the searcher. Searchers are basically anyone in the community who's using Fast Tracker to find information. Searchers do not need to log in ever to find information. They can be individuals and family members looking for basic information and services, or they could be treatment providers, care managers, and healthcare professionals seeking continuing care openings and treatment planning options. Fast Tracker is an open source tool and meant to be accessible to everyone. Searchers can tailor their choices so they only get the results that they're really looking for. That includes daily openings for substance use disorder treatment programs. Searchers can filter based on current medications, current circumstances, special circumstances, and needs such as moms with babies, languages spoken, that kind of thing. No surprise that we've seen an uptick in searches for virtual services lately. Results will be displayed on a most recent update basis. We're happy to boast that 50% have updated in the last 48 hours, over 50% in the last 48 hours, and over 62% in the last week. Fully over 70% of our Fast Tracker profiles have updated in the last 2 weeks. We're very happy to say that when those those search results come up and searchers find the results and see how quickly it was updated, they're assured that the credibility of the information is right up front for them. It is new and improved. If you haven't checked out Fast Tracker lately, please do. We've grown a lot and we continue to learn and evolve with your partnership. I'm proud to say that Fast Tracker is a strong, reliable tool for Minnesota, and we encourage you to join us as admins and searchers and to help us spread the word. And again, we are looking for your information, for your input, for your suggestions. We're always happy to collaborate with you to make this the best tool it can be. Before I hand this off to Samantha to demonstrate, I want to take a minute to just acknowledge her contributions. I can't say enough about Samantha. I do this to her all the time, but I am just so grateful and so happy to work directly with her. She's smart, passionate, committed, experienced as an LADC, and really she's able to connect the pieces to make Fast Tracker thrive. And she'll demonstrate Fast Tracker's functionality and tell you more about the ways Fast Tracker can help you and your clients that you serve. Samantha?
Thank you, Linda and Cindy. As mentioned earlier, I'm an LADC and I'm very passionate about Fast Tracker. This is why I'm with Fast Tracker. I'm also so honored to be presenting to all of you and with these two amazing leaders. I'm going to start by talking about how to use Fast Tracker, both as a searcher and a program or clinic administrator, and to show you how truly amazing and life-saving this is. I will end this presentation with some analytics and some information on how many people are able to access Fast Tracker. So I want to start with the Fast Tracker main page here. So this is when people go to fasttrackermn.org, this is going to be the landing page that they find. Here you have the home page, which gives you access to the, as Linda mentioned, the COVID-19 support and information, which is the COVID care support services and how people can get free 20-minute sessions with licensed professionals if they're struggling during these times. It does have the link to both the mental health resources and then our substance use disorder side as well. You can click on the About to find out a little bit more about the background that we've talked about and some of our sponsors, as well as who we are endorsed by. So if you are looking for your substance use disorder resources, you would click on the blue box here that just says your link to substance use disorder resources. If you click on that, it will bring you to the substance use disorder page. I'm going to go ahead and log out because I'm the admin and I want to show you that you don't need to be logged in order to find what you're looking for. This landing page has a lot of really great information. So it does have a little bit of information on the background on how to pay for treatment, making sure that people are connecting to their insurance companies. And if they don't have insurance, how to work with your county and to get an assessment from a treatment program to find out if you're eligible for funding. It does have, more information on here. All of these blue links are clickable and they will give you more information about questions that people may have. We also touch on this page on problem gambling, which is also touched on here, as well as the crisis line and the suicide prevention line. We really want to be a one-stop shop for resources. This also has our COVID care support services here. And here, there's several ways for you to find services. So if you're looking for services, there's a green box here that says find services. It also has that same it brings you to the same place by clicking on find treatment. So we'll start with not having to be an admin and logging in if you're searching for services. So when you click on find treatment, it will bring you to our search page. Our search page we've made extremely simple for anybody who maybe doesn't have a great idea of where they're looking for services, but we've also made it have the ability to be as complicated as needed. You can put in as many services as you or your client or friend or family member might need. The more services you enter in this box or the more keywords as well as zip code, it will narrow your searches down, but it will get you exactly what you're looking for based off of what the admin has listed on their page. So when you click on searching for services, it's going to give you a drop down of all the services that our admins and programs have mentioned that they offer. And part of my role is to make sure that those are accurate, and that program is still able to offer that program or offer that service, and that they're up to date and licensed. So these top couple ones that have the asterisk on them are going to be the services that have immediate availability. This is why we depend so strongly on our admins to keep that information up to date, because we want, if somebody's looking for immediate availability, we want them to find the programs that are immediately available. So that's on the top, but as you scroll or when you type something in, it'll show up underneath. So there are the same services as well as other services that may not have immediate availability, but they are something that you are needing at that time. And so we have things, very specific, culturally specific or focused, deaf or hard of hearing, co-occurring, culturally specific. We also want to make sure that people who are looking for opiate support services are able to find those. So we have several different ways to find, opiate treatments as well, opiate treatment. We have, MATs listed, things like that. We also give people the ability to list what kind of opiate support they have. They can list the medications that they use. So if that's something that somebody's specifically looking for, they're looking for Suboxone in their treatment program, they can find that here in the services, or even putting it in the keyword. So let me demonstrate a search for you. I'm going to start with just kind of a basic search. So you can go ahead and look for adult residential with openings available. You would click on this. If you had anything else you wanted, you could put it as a keyword. You could also add it as on, another service. We're going to make it pretty basic right now. I'm going to leave out the zip code because I want to show you the difference between putting a zip code in and not putting a zip code in. So if you're a mom and all you know is that your son or daughter or your friend needs residential treatment and they need it now because they're ready, you could just put that in, click the search button, and you're going to get some results. So we're going to get 83 results in this case. It's going to go in order of who's updated the most recent. So as you scroll down, you can see when they last updated their program, and that they do in fact have residential openings. So that's going to assure you that when you call that treatment program, if you really are able to make the location, and you really see what they offer and you think that would be a good fit, when you call them, you can let them know, I found you on Fast Tracker, it says you have openings, and that person who made that known will let you know, yep, there is an opening. So people don't have to call 15 places before they find a place. That can sometimes deter people from continuing their search. So that's what is really magical about Fast Tracker. Now, like I said, it goes in order of when it was last updated. So if somebody is specifically looking for a specific area, typically with residential treatment, I've found my clients aren't really as concerned about where it is in Minnesota since they'd be living there with the residential services. But if they want it to be somewhere semi-close to home or a certain area, they need to be out of a certain area, they can go back up and pick any zip code. I'll just pick the top one. And when you search, it's going to narrow it down a little bit more. So it went down to 47 results. So how this is going to happen is it's going to stay in the same order of who's the most up to date, but it's going to go in categories. So it's going to go day by day. So the most up to date that's within a certain amount of that, I believe it's 50 miles, it will show up in categories. So people who updated today will show up who's the closest to that zip code. And as you continue to scroll down, it'll continue to be that day that they've updated, and also taking in mind how close it is to that zip code. So as you continue to scroll and you get past the most recent updated programs, then the next one will go the closest for the next most recent update. So this person is a day behind, so still within the 24 hours that we ask people to update, but then it goes in order of what's closest based off of who's then updated on the 23rd as opposed to the 24th. So that's a really nice feature because we want to take into consideration zip code and area, but also really important to make sure that you're getting the correct information. And if you are requiring something to be immediate, that you're able to find that right away without having to call multiple places. So again, like I said, as you continue to put in more, services and things like that, let's say that you're looking for, a specific kind of opiate withdrawal medication to be provided, or you are looking for a comprehensive assessment, you are looking for culturally specific services, the more you add, the narrower the searches are going to get. So that went from 47 to 3. Again, goes by who's the most up to date and also then who's the closest. But it has all of the things that you continue to put in your search. So let's say this is exactly what you need. You've narrowed it down. There are 3, and you looked at this person's listing just from this brief listing here, and it sounds like something that you're interested in. If you want to know more about that program, you just click on the name and it'll bring up their profiles page. So this is going to have a map to help people find exactly where it is, see kind of what it's around. It's going to show you the services, including what's available, which are these 2 options down here. It does have the prohibited medications that are not allowed at the facility. And then this is a program note area where we ask our administrators to put more information. This is a great place for people to capture, providers' profiles by keywords if they don't know what the service may need, but they think that they need something like a Rule 25. They know that that's something. This would be captured by the keyword because they have that in their notes. So that's how you would get to that program. You can change your searches to exactly what you need, whether that be minimal or maximum amount of things. One other thing I do want to mention about this search page here is our additional resources, which not only are going to have all of the registered programs that we do have on Fast Tracker. Clicking this button will bring you to a list by city of all of the programs that are registered on Fast Tracker. Now, we do not require programs to be registered on Fast Tracker. However, if they are on Fast Tracker, we do require them to stay up to date. And so the next button down is going to bring you to all of the licensed program in the state. That is going to link you over to DHS's license lookup page so that you can see a list of all of the programs in the state. So like I said, not all of them are registered. A very good amount are. And part of my role is to continue to reach out to programs and facilities to make sure that they are listed so that everybody can use them as a resource who is searching for updated real-time availability. We have a list of all tribal licensed programs. We did want to put information on VA addiction services, both in the Minneapolis and the St. Cloud area, as well as the border states. So Fast Tracker does allow border states programs to be listed on here because, again, a lot of times if it's not, in California, somebody in Minnesota would be willing to go to a border state, facility, even if they might live close to the border and it's the closest program to them. So we wanted to include them so that they could also be another resource for Minnesotans. So that is kind of the search page here. I do want to just quickly touch on the mental health page. We also have a mental health side. A lot of our substance use programs have that co-occurring or have the ability to deal with a lot of mental health as well. However, if somebody is really being managed in a substance use program and you're a case manager, but they're looking specifically for mental health and they need it close to their area or they need a specific thing that you don't offer, that's where you would want to click on our mental health side on that main page. That will bring you to our mental health page. So it's very similar to the substance use page. Looks a little different. Again, has our COVID care support right here, has your home page, has the search page, and then it has more information about the mental health side. So just the exact same way that you would search for something on the substance use side, you would click find a clinic. We have the keyword here, services here. Again, that does a drop down for you. Now our mental health providers, we ask that they keep it up to date within every 2 weeks because oftentimes their services availability don't change as rapidly as a substance use program might. One different thing we have here is that we do offer them putting in their insurance plans because funding for mental health is very different, but we always still encourage people to call their insurances to make sure that it is a covered service and that it is a covered clinic or provider. They can use the postal code, and the difference here too is that we have a button to click for immediate availability. So it's not actually on the services that drop down. We have it right here. So if you are looking for something and all you know is you have extreme anxiety and you need something right away, go ahead and click search. Same way the substance use program does. It's going to come up with a list of programs, 210 in this. And you can go through all those services and find exactly what you're looking for. So we want you guys to know that that's a resource as well, and to utilize that. I'm going to go back here to the substance use, and I just wanted to focus quite a bit on a couple of these links here, give you a little bit of information. So we do have a list here of programs that are SOR grantees, as well as some information for you to contact them if needed. So we keep this up to date with DHS. We have a helpful information page, which, like I said earlier, some people know exactly what they're looking for. They know the definitions. They know what that program is. They know what the services listed entail. Some people don't. In fact, a lot of people don't. They just are scared. Their daughter or son or their friend or their husband or spouse just told them, you know, I drink every day until I'm blacking out and I'm scared and I want help. And so they know to go ahead and look for something and look for it right away, but they want to know more about what some of those services are. That's where these common questions come in. So if you needed to know the definition, you would be able to click on these and it would give you a definition and give you the answer to the question so that you have a little more information, as well as some useful links. So what to know and how to find alcohol treatment, getting help. So they click on these and it'll bring them to, you know, the pages that will give them the answers. So this is a really great resource, and we want people to be familiar with this as well, so that they can find the answers that they have. Again, we really want to be that one-stop shop for you to find what you're looking for and feel confident moving forward to get the help that you or somebody you know or client really need. Since we encourage everybody to be on here, so the administrators, they do log in to update their profile. And they do that by clicking admin login here. So I log in, I'm already logged in. I keep it, you know, saved onto my computer, which is how as an admin, it will take you very little time. If you add this page to your favorites and you save your login information, you can click on your favorite and go to the login page and it would already be, you know, set up. You would click login. One thing I do want to mention is, let's say you do forget your password. We do have the ability to reset your password here. And if you're a new program that wants to be listed, you would click admin login and you would register your program here. That would send me an email. I would make sure you're licensed and that you have all the requirements. I would add you to the page and you would get instructions from me personally on how to set your page up, and you would get reminders to keep your information up to date from me. So let's go ahead and log in and I can show you the abilities as an admin. So because I'm an admin of the entire page, I have a little bit more abilities here. However, you would go to your admin here. You could click on your profile, it would bring you right to your page, or you can click on manage programs. Some people manage multiple programs for their company. When you click on manage programs, it will bring up the list of just the places that you are the admin of. So it's going to bring up a list of all of the places that are listed because I am the admin to all of those. And once that comes up here, so it would list, let's say it listed only one. You have the ability to edit. I have other abilities because I am the main admin. But as you edit your program, you would click edit, it would bring you to your page. This is where you can type in. You can change your website if needed. You can add additional information, as I had mentioned, that would be able to help people who don't know exactly what they're looking for capture your services by keyword. You can add services here. Again, we've made it easy as you click here and you can add from the drop down of lists. If there's something on there that you do not have, or you have and we do not have listed, that's where you would email me and I would help get that added so that, again, people can find exactly what they need. So this is the main most important part right here. It's going to be what's available. We really want you guys to continue to make sure that you're putting what's available or what's not. So let's say you just found out that you no longer have adult non-residential, you would unclick that. Just one click of the button. I'm not going to take that away from them, but you would change anything you need, or even just go over it, quickly glance at it, say, oh, yep, nothing has changed in the last 24, 48 hours. The most important thing to do is to hit update. even if nothing has changed, you really need to hit this update button, because otherwise this date right here will not change and people will not know that your information is reliable. So really important, even if nothing has changed, to always just click the update button. And doing a quick glance over, that's why it could take under 30 seconds. You just glance at it, no new services have been added since the last time you updated, no additional information, and your treatment openings are still correct. Clicking update, and then that's all you needed to do. So I'm always available to have people email me if they have questions. As Linda had mentioned, we do encourage you to have multiple admins. Adding it to your daily calendar, adding it, if there's 5 of you, adding it to your daily calendar once a week to keep it updated. We really want to be reliable to our searchers, but we also want to have people find the services they need. And if you're updating, like I showed you, you're going to show up in the top of that list so that people can find your services and give you a call and get into your program as soon as they need it. So you log out if you're done, or you can stay logged in as I do. That is kind of the run through of how it works. So just a reminder, you do not need to be logged in to find treatment. Use as many or as little services, keywords, use zip code. You don't have to. If you don't know what you want and you want to see what all of the programs that we offer on the page are, using these additional resources and clicking on all, viewing all of our registered programs is a great way to start. They are broken down into city. So if you don't know the zip code, but it's in a certain city, clicking that will bring you to places by city. So it tells you how many are in each city. And then it lists them with the ability to then again click on them and bring you to their profile listed on Fast Tracker to learn more information. Okay, so I had mentioned earlier that I was going to give you some information on some analytics and how many people are able to find us and use us, and how much growth we've had, at least in the last couple years that I've been a part of this program. So most recently, between June of 2020 and September of 2020, that main page I showed you has gotten over 6,000 users with over 11,000 sessions. So that means that it might have been the same person coming back approximately 2 times in that time period. It could be all new users and just a couple coming multiple times, but that's just the average. So people who go to the main page, oftentimes that's where people land, and then they go to either the mental health or the substance use side. The substance use disorder page had over 4,300 users in that short time with over 7,400 sessions. A lot of people get to our main page from several different ways. 3,690 of the visitors have gotten there directly using the web address, so typing it in and already knowing it. And then 1,963 had came from a referral source, so those are partners. A lot of times it's admins or other programs who have us listed on their web page, counties, DHS's web page, people who want their viewers to find us as a resource as well. 1,400 people searched for how to find treatment and found us, went to our page. And then around 200 visitors have come from a social media platform. We do have social media platforms. We are, our main social media that we use is Facebook, but we do have a Twitter and Instagram, and we are on LinkedIn. And then we do send out newsletters to our admins, and 7 people have used those links. Usually they already have that saved as a favorite, so they don't need to click out of there. But this is really evidence that more people have saved that web page to a favorite and that they know how to find us. Earlier on, we weren't getting as much traffic, and people were finding us different ways because they weren't familiar with it. So that is the main page. The substance use page mainly gets fed from the home page. So the home page gets about 3,200 people getting from the main page, but people are also coming from searches. So we have over almost 1,500 people who searched for substance use, and it brought them right to the substance use page. 2,610 people came from a referral source. So again, that's another web page that had us linked, and that was directly to the substance use side. And then typically our social media posts tell people to go to our main page, but around 20 people have clicked on it from a social media post. So again, we wanted to just mention about our social media. It's really been growing. We get a lot more interaction. We have a lot more followers. So check us out if you haven't already on Facebook. We're just www.facebook.com/fasttrackermn. And then you can find us on Instagram, Twitter, and LinkedIn. One thing I wanted to mention is we have been featured in articles, local news channels, and several of our partners' social medias and web pages. Just a couple examples of things that you may have seen or heard about us. Minnesota Governor mentioned us as a great resource for finding resources specifically in these tough times when you're looking for telehealth or virtual groups. And then most recently, we are October's Centerfold article on how to find virtual online resources in the Phoenix spirit. And they mentioned how we're an amazing resource and that to check us out to find more up-to-date listing. I did give them a listing of all the places that offer virtual and telehealth during the time that I sent that, but they do mention to always check back because like I said, we stay up to date and things could have changed from the list. So that's kind of just a little snippet on Fast Tracker and our growth. If you have any questions, we definitely encourage you to ask those. If you think of something after the presentation is done, I have put up a list here on how to reach all of us. So Linda, myself, we do have a mental health specialist. So we do have Emily, and she's a licensed marriage and family therapist. She manages our mental health side. We both are able to help for either side. We're trained on both sides, but because she specializes in mental health and I specialize in chemical dependency or substance use disorder, I've listed our information for you to contact us. Linda had also mentioned this. We want to just thank everybody for their support and their time. We are always open to suggestions. So when we first started this, or when Linda first started this, before I was even aware of the program, things were very different. It took a lot longer to find things. It took a lot longer to update things. There weren't as many services, but it's really been our searchers and our administrators who have given us suggestions on how to improve, and we are continuing to improve, and we want to continue to improve to meet everybody's needs. Don't hesitate to ask us questions. If you need anything, if you have any questions, just email us. One thing I did want to mention, just personal experience as a licensed alcohol and drug counselor. I have been a primary counselor. I have been managed care. I've been a case manager, restricted recipient case manager. I've been in high stress situations where, you know, I needed to find something for somebody now. So what I did when I first started with Fast Tracker is I went ahead and did a time trial, a few actually, on how I had done searches to find exactly what my patients or clients needed. You know, just having the knowledge I have, it was a little quicker to do that time trial the old-fashioned way than some people who have no idea what they're looking for. So it had taken, I believe it was 46 minutes for me to find a program for, you know, said client and to find an opening, and I had to call them, I had to Google them. I was able to weed through what showed up, knowing, you know, that's not an actual program or that's not what I'm looking for. So that's why, you know, 46 minutes is still quite a bit of time. And I thought it was actually pretty fast for the old-fashioned way to find an opening. And I actually called places, asked if they had openings. A lot of times was told that they didn't and that I would need to try back, or that they might have openings next week. So that took me 46 minutes. So then going over to Fast Tracker and using that same criteria for my mock client, it took me 6 minutes. From the moment I, you know, put in fasttrackermn.org, got to the substance use side, got to the search page, put in what I needed, called the first place that said they had an opening that was up to date, and they said, yep, in fact, we have an opening. So that was from the moment I typed it in to the moment I got off the phone, it was 6 minutes. So as a case manager, I wish I would have known this would have been so time time saving and stress relieving, because I had so many clients that they called me, they said they wanted it now. If I told them that I would call them back once I got a resource and wasn't able to get back to them for sometimes days, because I would leave messages and people would have to call me back. By the time I called them back, they weren't interested anymore. Something had happened. You know, addiction is a powerful thing, as is mental health. And at that point, they had decided they no longer wanted that care. So I really do think this is extremely life-saving. I love this, and I believe it's going to change people, change families, help people, help providers. I know Emily, our mental health provider, our mental health specialist, always says, I never knew about this. I don't know enough about substance use disorders to have been able to give my patients the resources they needed. And now not only can I utilize Fast Tracker, but I can give it as a resource. And she does still continue to have a private practice, so she does that as well. And she does hand it out. So you'll find me at the grocery store handing out cards to people, or mentioning the COVID care support systems to, you know, some of our essential high stress jobs, but it is open to everybody. So that is kind of a little bit about that. I did also want to quickly mention that this is recording, and we recorded it in September, so September 24th. So I showed you in those search results that the most up-to-date resources were 9/24. So that was as of today. So those are the people that as of today, they have updated. And as Linda mentioned, that over 50% of people are staying up to date within the last 48 hours. And that really, you know, we are so grateful for that, because if they haven't updated, it can change in a minute. Working in residential, I know how fast beds change, and that's why we've streamlined that process and made it so that it's literally a 30-second thing. So if something changed, somebody wasn't able to be admitted, funding changed, motivation changed, log in, click that it's available so that somebody can fill that spot and somebody can get the help that they need. Again, if you have any questions, or if Cindy or Linda have anything to add, you can go ahead now. Otherwise, we have this information up, and type your questions into the chat and we will answer them as they come.